And our next speaker is going to be LITJEN, who's the Chief Strategic Officer for the Immunization Action Coalition. Prior to joining the coalition, he was the Director of Medicine and Public Health at the American Medical Association, and he brings his expertise on adult immunization to this discussion. LJ?
Thank you, Noni. And just to confirm, I hope you all can hear me and see my slides. Just a quick yes would be wonderful.
Yes.
Thank you. So I've been asked to talk about adult immunizations and reducing barriers and increasing vaccine uptake. I have no conflicts of interest. And as this disclaimer shows, I'm going to just try to quickly give a little background on the adult immunization arena in the United States in terms of just a burden of disease. Because in order to really understand why we want to improve and reduce barriers and improve uptake, is we've got to understand where the burden of disease is. And this is going to be specific to the United States. But as Saad has already suggested, adult immunizations are not well performed across the world as well. And then I'm going to kind of talk about those barriers, talk about some strategies, and then kind of wrap up from there. So just a quick run through for the next 3 slides. I'm not going to test you on this, so you all don't have to memorize this, but just to show that because in the United States we do have a really well-developed pediatric immunization program as well as an adolescent immunization program, the burden of vaccine-preventable disease in the U.S. is predominantly among the U.S. adults. And so we're looking at things like invasive pneumococcal disease, we're looking at influenza, pertussis, we're looking at hepatitis B, zoster, and even measles. And I use measles to point out that the attention paid to adult vaccine-preventable diseases is actually not very good. Because if you think about what happened with the measles outbreak in California, the multi-state outbreak that began in Disneyland and received a lot of media attention in the United States, we're talking about an outbreak that changed legislation in California. And yet, if you look at the actual data, 55% of the total infections from that outbreak were in adults 20 years of age and older, but you don't hear about that. And so I think one of the things that we need to really think about in terms of the adult vaccine-preventable disease arena is this idea that we have a burden of disease, we have effective vaccines against these diseases, we have evidence-based guidance that are issued by WHO and in the United States by the Advisory Committee on Immunization Practices. And the question, and then if you don't go with all of that, I think we also have to recognize that there is a tremendous cost burden because of adult vaccine-preventable diseases in the United States. And this is just a simple slide to kind of show you that if you look at 65 and older, the bottom line of an annual cost because of 4 vaccine-preventable diseases that you see on the left-hand side is shown in the red. So that's about $15 billion is attributable to these 4 vaccine-preventable diseases. And if you take the age group down from the 65 and older, which is what this looks like, and bring it down to 50 as well, you can add an extra $11 billion. So that being said, right, if you think about this, we've got a cost burden, we've got a mortality burden, we've got a morbidity burden. You'd be saying, well, we should be vaccinating our adults. It's a no-brainer. But unfortunately, we are not. And this is one of the reasons why I'm here to talk about some of these barriers and some of these strategies. But before we do that, just kind of show you how badly we're doing in the United States with regards to just a couple of adult vaccine-preventable diseases. So here we're looking at pneumococcal. The little bullseye that you see are actually Healthy People 2020 goals that were set, 90% for over 65, 60% for those at high risk. And if you think about that high risk in that middle section, you're talking about people who are going to really suffer severe complications and consequences from pneumococcal disease, and yet we're only vaccinating them at about 20%, and this is data from the past 4 years, going from 2017 at the top, going down to the blue of 2014, and you can tell we are not doing well with them at all. And then if you look at our zoster immunization coverage rates, we're hovering at about 30%, and obviously we hope that that will also improve. But the gist of this slide is that we are not doing well with these adult vaccine-preventable diseases. And if you look at influenza, where in the United States we have a routine recommendation to vaccinate anybody that's 6 months of age and older, and if you look at this, you can see that in the U.S., our coverage rates for adults over 18 remains kind of hovering at about 45%. And if you look at some of the high-risk populations, we don't do well with those either. And that's going to become important, I think, as we wrestle with COVID-19 disease this fall. So that being said, I want to quickly also show you that, while we have these poor adult immunization coverage rates, and Saad kind of hinted at some of this, COVID-19, not only did it do a number on our pediatric immunization coverage rates, it did a number on our adult immunization coverage rates as well. So we saw declines in adult immunization coverage rates that were widespread across multiple vaccines and across multiple age groups. So just some examples: 67% decline in herpes zoster vaccination coverage rates, 88% reduction in the use of PCV13 vaccines at the Veterans Administration facilities in the United States. And as was suggested by some of the presentations that Saad gave, regional variability in the way COVID-19 is impacting the United States also obviously impacted vaccination-seeking behavior. So, where we saw increases in COVID-19, that led to declines in coverage rates. And so, obviously, localized planning is going to be key to how we can address these different situations and differences in timing. And while in the United States, our routine immunization coverage rates are returning to pre-COVID levels in pediatrics, our adult rates continue to lag. And then significantly, our pediatric and adult catch-up vaccination rates continues to lag and remains absent. So a large number in the United States still remain under-immunized. And we've also seen significant declines in wellness visits for adults of all ages, and there's been no recovery to the pre-COVID-19 levels yet. And so we're hoping that that will continue to improve as we go forward. And of course, and as a result of COVID-19, we also have seen visits to ambulatory care plummeting. And I think this is subject to some questions that have been popping up during the previous presentations that we maybe can address, is this idea of how do we reassure people that as we ask them now to come back and get vaccinated, adults as well as pediatrics, how do we assure that they're going to feel safe and confident that they are not going to catch COVID-19 when they come out? And of course, one of the answers that we're beginning to see in the United States is an increasing use of telehealth. So that kind of sets the stage for the last like half of my talk. And the question that we're trying to obviously look at is why is it so hard to vaccinate adults in the United States? And I think, as suggested earlier, globally as well. And I think if we look at factors, there are three big buckets of factors that we can look at. I think many of us, we know what these factors are, so I'm not going to go into details on each of these because I think that will be a whole separate presentation. And in the interest of time, I want to kind of move along so that we can have everybody speak. There are patient factors, right? So a lot of patients adult patients don't have what we call that regular healthcare provider, unlike our pediatric practices where there's a very specific pediatrician healthcare provider that they're seeing on a regular basis because of well care. So a lot of our patients do not have those regular healthcare providers, and so they're not getting that regular interaction that asks them and reminds them and advises them for immunizations. For adult patients, their access is a big deal, and COVID-19 is very, very much showing us that. There's not only geographic inconvenience, but there's also social and economic demands that show us obviously why we have disparate access for adult vaccines in the United States. And in the U.S., because we do not have an insurance program, a coverage program for uninsured adults and underinsured adults, we have many of those patients who don't have insurance to cover vaccines. There are provider factors. Unlike pediatrics, where we have this well-established WellCare visit platform, adults don't seem to show up for preventive services as well. And so there are provider factors, such as where we have now adults coming in, but they're seeking care for acute issues. And therefore, these issues compete with preventive services, and as a result, we see a lack or reduced provider recommendation for adult vaccines. And we also see reduced and a lack of effective reminders to providers to offer vaccines to their adults, to assess and offer vaccines. And then there are finally system factors, and this is where I think in the United States we have the most opportunity for success, the lowest hanging fruit, the most bang for the buck, as we like to say here. These factors where we change the healthcare system, which then allow us to kind of improve vaccination across the board. And so these are system factors that we are hoping that we'll be able to address. And finally, I think this is true everywhere. There is a fairly complex adult vaccine schedule. that makes it a little bit harder for providers as well as patients to understand the vaccines they need, and for providers to obviously recommend the vaccines that they need. So that being said, I think I want to point out is that note that vaccine hesitancy or vaccine confidence is not a frequently identified problem with adults. But my big concern is that that might be shifting. And one of the things that might be shifting that may be COVID-19. So this is data that's from some research polls that have been done recently, and this supplements and confirms the data that Saad presented earlier, and that only half of Americans would actually step up and be willing to be vaccinated with the COVID-19 vaccine, and that the hesitancy and trust issues are higher for Black and versus white or Latino respondents in some of these surveys. And so I think let's take a look at this, because I think this may be, and I hope it will not be, the future of some of the vaccine hesitancy in adults in the United States. So if you look at, again, this survey, 49% of American adults will get that vaccine against COVID-19. 20% right off the bat has said no, they're not going to do it. And then there's that 31% that's not sure. And again, this is, again, very consistent with what Saad showed earlier. If you break that down and you look at the younger adults, they're more likely to not seek vaccination. And then if you look at race and ethnicity, our African-American population is most likely to not seek vaccination. Then if you find out why would you get that vaccine? The rationale, the top rationale is I want to protect myself or protect my family. But if you look at the reasons why they would not get a vaccine, the number one reason is side effects from the vaccine. And I think this, again, harkens back to some of the questions that have been popping up, some of the discussions that have been going on about how do we continue to reassure that as we go through this development of the COVID-19 vaccine, we're not shortcutting safety and obviously efficacy. And obviously, there's this weird concern about getting infected with the coronavirus from the vaccine. And then obviously there's the concern about that this is not really a very serious illness. What's interesting about this, and this is why I sometimes worry about the impact of this into our future with adult vaccine hesitancy, is that there's a strong overlap of these vaccine concerns with influenza vaccine myths that we have heard of. And if this begins to get conflated and mashed up into one, I'm worried that we're going to begin to see increased adult vaccine hesitancy in the United States. So I'm going to wrap up by quickly talking about some of the strategies that we know work. From the community guide, we know that if we enhance access to vaccines using innovative access points, eliminating costs to the patients, we get better vaccination rates. Increasing community demand by obviously reminding the patient to come in, providing family incentives so that the patient comes in, gets vaccinated, and maybe they get a coupon to do something, or they get like a free membership to a health club or something like that. Those things that are being offered by some of our health insurance plans increases obviously the seeking behavior for vaccines. Importantly, leveraging the healthcare provider is a huge deal. The concise, consistent, confident recommendation that's presumptive tends to work really well at getting vaccines into people's arms. And so we need to continue to leverage that healthcare provider. And then finally, as I mentioned earlier, we need to really consider about engaging that healthcare system. We know that systems-based change works. So what are these systems-based changes? I'm going to show you a couple of these things. Things like standing orders, things like provider assessment and feedback, provider reminder systems that come out through the healthcare systems through a connection between the electronic medical record of the patients and any kind of immunization information registry, right? Connecting those two, using those to prompt providers to assess and recommend vaccines. All those system-based changes work. And actually, when you put them together, these organizational changes, they work really, really well. If you look at this publication, an odds ratio of 16.0 when you do these organizational systems-based changes to improve immunization coverage rates. So I think one of the things I want to try to help us kind of understand is that with adult immunization, and Saad kind of touched on this, we have an opportunity actually with COVID-19 to leverage COVID-19 to establish and improve an existing infrastructure for vaccination of adults. It's not the greatest, it's not the best, but it's improving. And with COVID-19, we have an opportunity to actually establish something that may sustain and become better so that we do better with routine immunizations for adult vaccines, because we are actually all in this ship together. We need to think about how do we engage our provider We need to think about the strong recommendation because that provider remains that trusted voice. And then we need to think about this innovative approaches to increase access to vaccines. I think COVID-19 is showing us how we can do this, right? Drive-through clinics, parking lot clinics. Those are all things that we need to think about and maybe establish and sustain into the future so that we can have a much more robust immunization system for adults as well. There are a lot of best practices out there that we've already kind of talked about and we can continue to look at. And for us coming into the flu season in the Northern Hemisphere, I think it's critical that we think about this hashtag, take flu off the table and hashtag avoid the twindemic, because I think if we can do that well, that will serve us really, really well for COVID-19 vaccination into the next year when vaccines become available because that infrastructure will be in place. And then we can also hopefully sustain it for the future as well. Before I wrap up, I just want to remind folks that there is a standard of care in the United States established by the National Vaccine Advisory Committee. And this standard of care is essentially that all providers of healthcare, not just vaccinating providers, but including non-vaccinating providers, they're supposed to do 4 things when they see an adult patient. They're supposed to assess the patient's status. They're supposed to educate, counsel the patient, and then recommend that vaccine. They're supposed to vaccinate if they can at the same visit, but if they're not going to stock the vaccine and they cannot vaccinate, they're supposed to then refer the patient to someone they know will vaccinate that patient. And then finally, they're supposed to then document the receipt of that vaccine. So in other words, don't just tell them to go get vaccinated. Make sure that when they come back again, they get vaccinated. So I think these are all the strategies that we're beginning to see come into place in the United States to implement a existing but improving adult immunization infrastructure. We know what the barriers are. We know what the strategies are. It's about implementation. And this advisory, the NVAC recommendation here is one way we're going to do that. And as we said, engaging, establishing, and sustaining that infrastructure, leveraging COVID-19 will continue to do us well in the future. I'm going to stop here and not talk about my last 2 slides in the interest of giving time back here. But again, one of the things I want to point out is one of the ways we can do that in the United States is to engage the healthcare systems that are now becoming very dominant delivery of healthcare in the United States. So thank you all very, very much. Noni, I'm going to stop and turn this back over to you.